All right, turning now to a serious story, the coronavirus in Maryland. The statewide positivity rate for infections is now more than 9%. Hasn't been this high since the beginning of June. More than 2,100 people tested positive this weekend. That brings the state total to 285,000. 17 people went to the emergency room. 27 more are dead. WJZ's live this morning. Annie Rose Ramos tells us what doctors say will take to end this pandemic once and for all. Annie Rose.
Max, good morning. We spoke with local doctors who say that about 70% of all Americans would need to get vaccinated in order to achieve widespread immunity. But Max, as it stands right now, not even 10% of Americans have any immunity.
As the number of new coronavirus cases is on the rise, so too are the number of people now getting vaccinated. Here in Maryland, 59,769 people have received their first dose of the coronavirus vaccine, but that's still less than 1% of Maryland's population. Former Baltimore City Health Commissioner Dr. Leana Wen says that part of the holdup is because of a lack of national strategy and guidance for state and local health departments.
I think the American people understand that vaccine distribution is going to be extremely complicated, and they'll understand missteps. But we, at this point, want honesty. We want for the federal government to say, hey, these were the barriers that we encountered. Here's how we're going to go about fixing them and course correcting.
The state is now seeing its highest 7-day positivity rate since June 2nd at 9.15%. More than 5,800 Marylanders have died.
The virus took the lives of 27 people on Sunday alone.
Dr. Matt Poffenroth is the chief physician executive at LifeBridge Hospital, who says in order to end the pandemic, you have to achieve what's called herd immunity.
Right, we have enough people that are immune that the virus will sort of start dying out because they won't have a host that they can live in.
This requires vaccinating anywhere from 70 to 80% of the population. In Maryland, this starts with frontline healthcare workers. Dr. Poffenroth says the majority of his staff is signed up or has already been vaccinated.
It feels like it's sort of a ray of hope. So there's we can't vaccinate people quickly enough.
And while more people are in the hospital, he says that PPE is in ample supply and that treatment options have improved.
And Max, in a small bit of good news, that same doctor says he hasn't seen a spike in flu cases this year. With less than 1% of ER admissions being flu-related, he says that's largely due to the measures being put in place to help stop the spread of COVID-19. Reporting live, I'm Annie Rose Ramos for WJZ.
Good stuff, Annie Rose. Thank you. A leaked internal hospital memo led to more than 2,000 people in Maryland signing up to get the COVID-19 vaccine, but they're not eligible yet. An email from Holy Cross Health in Silver Spring went to medical workers, but ended up being forwarded to family members and other community members. The email included an invitation to sign up for a vaccine. Hospital workers say there are only enough doses for colleagues and active staff, says the memo got sent out by mistake.
I think there was absolutely not an ounce of malicious intent. I do believe that people right now are just excited. I would ask for the understanding to know that we must first vaccinate our frontline healthcare workers.
Holy Cross is now in the process of canceling all appointments claimed by members of the public.